So welcome everybody. This is a 90-minute presentation on herbal treatment of seborrheic dermatitis. We're going to talk about the pathology itself. We're going to look at a particular case that I treated in my clinical practice, and then we'll talk about the herbs that were used and why those herbs were chosen. There are age peaks for the incidence. That is early in life, the first 3 months or so of an infant's life, again during puberty, and then somewhere between 40 and 60 years of age, there seems to be another peak. He had been symptomatic for about 7 years, and it had begun while he was on holiday in Mexico, and he was wearing a hat on that holiday, and he sweated a lot. When he came back from the trip, he realized that the sort of irritation on the scalp from the sweating just actually wasn't healing. It has these great anti-inflammatory compounds in it. It inhibits proliferation of lymphocytes, reduces interleukin-2, regulates cytokine production, interferon, tumor necrosis factor. So it has some really interesting anti-inflammatory or mediating of inflammation, let's say. So clinical outcome. Dramatic decline in the number and severity of lesions within 2 weeks, and within a month he was 90% improved. Don't you love it when herbs work? I do sometimes teach classes about what went wrong, dreadful mistakes I've made in clinic, but I do really like to teach ones that do well. So here's a story that he did great. Okay, let's move on and look at the diet part. So I understand, of course, that we are principally herbalists, but I don't see any way to separate diet from herbal medicine. They are, in my mind, a continuum, one and the same. So if I have rosemary in my meal, I'm getting medicinal benefits as much as if it was in a tea. So I use diet as an integral part of my clinical practice. And certainly in this case, I believe it was an integral part of the success of the case. I do believe that the herbs would have given him symptomatic relief, but I don't believe that they would have been sufficient without him making those fairly substantial diet changes that he did. So let's talk about the hepatic herbs for a few minutes here. So herbs that work on the liver are working through liver and gallbladder because they are sort of linked in the body, of course. They're often bitter, not always, but often bitter, and they may be cholagogue and or choleretic. And just to be clear, a choleretic increases production of bile, and a cholagogue increases flow of bile.